All right. Thanks, everyone, and welcome today for joining us at our coffee break, FP&A for Healthcare Organizations. My name is Tracy Thompson, and I'll help facilitate our webinar today. Before we get started, I have a few tips on using our Zoom platform so you can engage with the presenters and have the best experience possible. You should see the following icons on your Zoom toolbar: ask a question, chat, and raise your hand. You can use the ask a question or chat to submit a question at any time. If you need any assistance, please click on raise hand and I'll connect with you as soon as I can. We do encourage you to ask questions throughout the entire presentation, and we'll address the questions towards the end of the webinar. If you experience any audio issues, you can access your audio settings and test your audio when you're already in the meeting. At the bottom of the left-hand corner of the Zoom meeting toolbar, you'll find either the headphone or microphone logo to join audio or mute, unmute. Click join audio to choose to connect to your webinar audio or dial into the meeting using a phone. Once you're connected, just go ahead and click mute or disable audio and unmute to enable your audio. So within 72 hours of the webinar, we will be sending out a link to download the slide deck and recorded presentation so you can have to reference or send to anybody else you feel would benefit. So for today's agenda, we'll be going over learning objectives and introductions, healthcare industry challenges and solutions, utilizing an FP&A solution to make informed decisions, and then we'll close out with some Q&A. So I'm just going to go over our learning objectives for today's webinar: better leverage the technology used in healthcare finance operations, gain deeper insights, automate tasks, reduce burnout, and increase supply chain resilience, create benchmarks and KPIs in your FP&A data to keep focus on relevant information, analyze the data that will actually help you lower costs and improve patient outcomes, adapt, innovate, and scale with fast tracking your digital transformation. And with that, I would like to welcome today's presenters. We have Ron Present and Gabe Masis. Ron's our partner in Healthcare Industry Group, and we have Gabe as our Senior Solutions Manager. Ron, Gabe, do you guys want to give just a little brief intro?
Sure, happy to. So again, welcome and thank you all for joining. My name is Ron Present, and I help lead our national healthcare practice. I've been in healthcare for just, let's say, over 30 years. It's close enough. Well, on the operational side of healthcare. So it's not, someone that's just getting into this. I've done this my entire career. And one of the things I'm excited that we're going to talk about is why we need to use an FP&A solution. So again, thank you all for coming. And Gabe, I'll turn it to you.
Yeah, thanks, Ron. So my name is Gabe Masis. I'm one of our FP&A solutions manager here, as Tracy mentioned. And I currently reside in Columbus, Ohio. So I spent my first half of my career at Ernst & Young within their audit practice, and then jumped ship over to the consulting world here at Armina within our FP&A technology consulting group. And my main focus right now is Workday's adaptive planning. I think we're going to start here with a quick polling question. So for Tracy, you want to launch that?
Yep, happy to. Thanks, guys, for joining. We're happy to have you guys as presenters today. So here's our first polling question. Does it pop up for you guys?
Yes.
Perfect. What is your organization using for a planning FP&A tool today? We have Excel, Workday Adaptive Planning, Sage Intacct Planning, not sure, or if you have another one, you can write it in the chat. A few more seconds here and I'll share the results. All right. So it looks like, per usual, Excel is the winner. That's good to know. Thanks for joining us. All right. And then Ron, we'll have you kick it off.
Sure.
All you.
Thank you. Thanks.
You're welcome.
So on the slide, which I'm not going to go through in great detail, are what we believe are some of the biggest challenges everybody in healthcare that has a decision-making capability is facing. One of the biggest ones, obviously, is staffing concerns, and I'm sure you've all seen the articles and everything, predictions coming out that we're going to have this problem again coming up soon as we kind of resolved it. So one of the things that you can accomplish with FP&A, we hope is going to help you manage and monitor that, as well as all these other things. But for me, my goal is really, I want to challenge you a little bit and ask you why you're not, why are you doing what you're doing, instead of asking yourselves what to do. So we have a lot of people that do things because this is, rote, they've done it before and it's always been this way. And what we're going to do is ask you why you're doing it and is there a better way to do it? So, in my 35 years of experience, I'm just going to say it's all different now, but it's really the same. Same kind of deal, issues that have gone on, lowering costs and improving outcomes is really, it's part of the quadruple aim goal. And it's really what we've been facing for years and years and years. So again, nothing new. It's just the environment that we're in, focusing on those goals happens to be new. So for me, data is a huge issue. And the two things I'd like to share, I look at data as one, is it cohesive? And the other one, is it collective? And what I mean by that, from a cohesive perspective, are all the data points on the same system? So the majority of you said you're using Excel, which has an opportunity for human error when it gets transferred between multiple places. So the other one is being collective and having everybody be able to share to that common data collection. So breaking down the silos. So hopefully your systems that you're using, including Excel, are cohesive and collective. Huge amount going on in the M&A world. And when a lot of our clients that are doing these acquisitions have multiple sites, they buy things, merge them, and then they have several different sites that they are trying to consolidate. That's really important to make sure that they get on the same system or be able to collect the data in the appropriate way. So the other thing I would share is, is it precise, timely, and the correct data to make an informed decision? In healthcare, every decision that we make has an impact, and it potentially has an impact on patient care. My belief has always been that if you do right by the patient, everything's going to fall into place. What we need to focus on as healthcare operators, managers, finance folks, is really, are we getting the data we need to be able to make those informed decisions? And I'll share with you one of the reasons why it becomes so important. Again, my world in the healthcare space is related to governance. So there is more and more, I'm sure all of you know, that there is more and more scrutiny of the boards that sit on, these potentially not-for-profit hospitals, maybe for-profit, but the makeup of your board and then the liability that the board is potentially at risk for not being informed correctly. I've been on boards, I've worked with a number of boards around the country, and the information that sometimes gets selected to share with the board isn't the full picture. So one of the things that we're hoping this will be able to do is help you reduce or mitigate some of that liability. The other big question that I have, and this oftentimes becomes challenging for folks, is do you know what your cost of quality is? I'm not talking about the cost of care, but what's the cost of quality? How much more do you have to invest to achieve a defined level or a benchmark you've identified or someone has identified for you? So if your goal, as you all know, on the 5-star system is to be a 5-star, how much better is that than being a 4-star? And what's your cost differential related to that? Those are things that we have to be looking at as, we are looking to try to reduce our costs, but still improve patient outcomes. So one of the ways that you do it is using KPIs or benchmarks. Collect the data, identify it related to some level. And one of the things that we often find is people compare themselves to other people or other systems, hospitals, et cetera. I would say set your benchmarks, comparing yourselves to you as the best you can be. So you want to use those other benchmarks, it's fine, but just achieving what they do isn't necessarily mean it's the end goal. So when you look at those benchmarks, the KPIs, et cetera, ask yourself, where did they come from? And really importantly, are they still relevant? We have clients I've worked with, like I said, a lot of organizations around the country. And when they look at their KPIs, it's really the question I have is, why are you doing this one? Or why is it this benchmark? Because it's no longer relevant. You've been doing this for so many years this way. Really have to look at what we're doing related to that. And then the other thing is how do you track your data, right? How do you get the data in your system that combines finance, strategy, operations, so that you are able to collect that data and, number one, create your KPIs or benchmarks, but get the data, so it allows you to measure it correctly and appropriately. So again, I'm happy to answer any questions that you all have. Please put them in the chat. But I'm going to turn it over to Gabe, who's going to share one tool we use that has the potential to achieve all the components I just talked about. So Gabe, over to you.
Thanks, Ron. So before we get into the actual tool and show you some of the cool functionality and how this could potentially help you as a finance user and as a budget owner, as a C-suite, right? Let's give you a quick background on why we're showing you this tool. So Harmony is one of the top partners with Workday to implement their budgeting and reporting cloud solution. It's called Adaptive Planning, and a solution of choice for many healthcare organizations. So a big portion of what we do is healthcare projects around Workday Adaptive Planning. So this is a cloud-based solution. You can access the login page anywhere you might be. As one of the leading solutions in the FP&A space, the solution was developed for finance professionals, right? So there's no coding and scripting involved to maintain the tool, right? It's for the everyday finance user. So us finance professionals can easily maintain and update our data with little to no involvement with any IT professional. So the tool is also meant to be your one-stop shop for all of your budgeting and forecasting and reporting needs. So the solution gives finance teams more flexibility and more time to analyze their data instead of putting together Excel files and tabs and building out the models and changing calculations and inputting data, right? It reduces that time, and you spend more time actually analyzing your data instead of compiling all this other pieces of items. So what I'll do is I'm gonna get into the tool really quick, but at a high level, just so that you guys are familiar in terms of where I'm clicking around. There's kind of three. The tool works in three steps. The first step I would say is your data automation. So which is going to be an integration from any application, right? Typically your ERP or data warehouse. We see folks integrate from sales and payroll, HR systems, pretty much any application can integrate into the tool. And you can have those actual data refresh as often as you want. So typically it takes seconds to minutes. So you think about that month-end close process and all of the journal entries, accounting is booking, and at the end of the month and the constant communication and get clean and accurate data. But the integration eliminates that back and forth. The second piece is really your modeling, where you're doing all those inputs, assumptions, calculations. It's all happening to build out your budget and forecast to be primed so that it can flow right into your reporting and dashboard. So I'm not really going to spend too much time on the modeling piece. And then the third part is what I just mentioned, is your dashboarding, your reporting. This is where we'll spend most of the time, like I said, and how users really will spend their time, analyzing the data, right? That data is now at our fingertips. It's been integrated. We don't need to worry about compiling all these different data points. Right now, we have clean and accurate data to be able to report in a reasonable manner. Okay, so I'm going to share my screen here. All right, and making sure you can see my screen just to confirm.
Yes.
Yep.
Okay,
you're
great.
Good.
All right, so here is what we call the dashboarding module. So you have the ability with these dashboards to have your own personal dashboard, build your own personal dashboards, or share them amongst other users of the tool. But if we look here at this dashboard, really you can see right off the bat, this is going to give you a bunch of key metrics. These can all be customized in a way, as long as you have the data within the tool itself, you can customize these dashboards in a way in the way that you want to see them, right? So really you can actually have these dashboards be the first thing where you log in, and especially for C-suite individuals, they log into the tool and this is what pops up, right? They're instantly analyzing, what are my key metrics that I want to see, right? And you can change the dates, you can change, departments, you can do all these type of things, right, within these dashboards to give you quick and easy results. Okay. So you can also share presentation mode, right? So you don't need a PowerPoint. You can have this presented and right at your hands there if you need to. The other cool functionality, right? So I'm going to go over here to provider plan. So, if you're getting curious and you're discussing these dashboards with your team, you can actually drill down into, so if I go to this visits by month metric or statistic, I'm going to click January. It's going to ask me how do I want to drill down this? So depending on the amount of data you have, intersections of data, you can drill down in these dashboards to figure out, okay, of those visits, these are all of the providers that make up that number in January, right? You can continue to drill down and continue to drill down, right? And have those conversations right here on the spot if questions are asked. So where's this data coming from? Well, I can continue to drill down within this dashboard. So again, it all comes back to that easily analyzing the data and getting down to that lower level of data that you typically might not always have that answer right away. Okay, so that's dashboarding. So the next piece I want to show you is the reporting functionality, how the reporting can essentially help you within your process. So I'm gonna click over here. I'm gonna go to this provider productivity by specialty group. And again, this reporting can be shared. You can make your own reports. You can share them amongst other users. You can do a lot of different things. So you can see here, this particular report, it's going to have your specialty physician practice group here. It's going to have different accounts, or in this case, you have different key metrics or different type of stat accounts that you can visualize, right, by the different specialty to the left here. But really, what you can do, you can also drill down on these, right? So I can click visits and I can drill down. Now I want to see of these visits, I want to drill down by in adaptive causal level, but usually that's department or practice or cost center, like depends on how you set it up. But now I can easily see and continue to drill and figure out what makes up that number, right? So again, you're not spending all that time trying to figure out what's the underlying data. You have it right at your fingertips and able to drill down, and I can continue to drill down if I want to.
Gabe, let me just ask you a question. So one thing to point out is that any user can modify what their benchmarks are, what they're looking for, et cetera, correct?
Exactly right. So you can do all those type of things. You can create these reports so that you have different filters up here. You can slice and dice your data to customize a report. You can input as much data as you want to see, and then be able to report on it in seconds within these reports.
And let me just add one thing to everybody. So why do you want to do this? So value, you're trying to determine which physicians you need to provide what level of compensation for. And they're like, I do more business than anybody else. Pull it up and you have the data available to make that informed decision. The other thing I would just add real quickly is that as we transition to value-based care, how you measure productivity, how you measure, data or compensation sharing, et cetera, you need to have a tool, something like this, to be able to create those so it's fair and equitable, which it never is in a comp plan, but we have to try.
I'm going to show you one more situation here. Now we're going to role play a little bit here just to kind of give you a feel. So right now I have, it looks like more of like a summarized income statement here. And I have two different versions. So quickly, the versions are important and adaptive because that gives you the ability to have different scenario planning, roll forward different forecasts, right? Instead of having Excel where you're maybe saving down version 1, version 2, version 3, all in the same, in different iterations, you have this version control in your hands. So you can do something like what I'm about to show you is, have these like what if scenarios, right? So right now, these two versions are the same set of data throughout the whole instance. But what I want to do is, you can see the variances of 0. in my what if scenario RN rate increase, I'm going to go over here to this. And this is where you get into the more of the modeling. And if you're interested in more, we can show you how the modeling works. But I'm going to go and change my version here. I'm going to go to my what if scenario to RN rate increase. Okay, so now I'm at that version. So let's just say this right now, this assumption that the RN hourly rate is $48, right? So what if I change that to 55 and I hit save? So I'm changing my assumption, and then my assumption now is 55 here, and then instantaneously I'm going to refresh this report, and now we see a variance, right? Well, what is that variance? So when you're analyzing this data, again, you can use this drill down functionality to drill and say, maybe you didn't know someone had updated this assumption. Well, now you can drill down and say, oh, it looks like we increased the hourly rate by 55, right? So to Ron's point, right, there can be many different scenarios in which you could use this type of functionality, right? Whether you should hire from agency staffing versus hiring from within your own, like those type of cost benefit analysis you can quickly do by using the version scenario situation and having the different version control. Okay. And then the last piece, so there's two ways of reporting in adaptive. So there's this, what we call like the web base. So it's right in the tool itself, but there's also a functionality called Office Connect. So Office Connect is gives you the ability to use Excel, but use Adaptive's data to then report. So a good use case is if you already have a board reporting package that you love the format, and I'm going to pull it up over here. You can keep that format, and then you can see this panel over here. This is all the like data elements that live within Adaptive. Now I can drag them into my report, and then I keep the same format. I don't have to do any changes to my format, right? That's one big piece of you can have your free form comments and many different pieces of functionality within, but you're also keeping that same Excel knowledge that and Excel reports that you've been using for a long time. You're just now using all of the modeling and data and stuff that you've been doing within Adaptive now in this Excel platform. So the other powerful thing is you can actually, this Excel file links with PowerPoint and Word, so that as you're doing your board book, right, your board packages, I can update this. So I'm going to pull up a PowerPoint. So you can see here we have February. So February, this chart here is the same thing as this Excel file here. Well, we have February. Well, now it's March. We want to update for March. Well, all I need to do is if I say this, all of this data rolls forward. So I'm going to say now we're in March, and I'm going to refresh all of these pieces of data, all sheets here. It's going to take about 5 seconds to refresh. Okay, so now all of my data is updated for March instantaneously for every single tab. So you can see now we've updated through March. And then I go to my PowerPoint, I refresh all, and now everything is updated instantaneously in my PowerPoint. I don't have to spend time redoing all these reports, right? March 2023, all my graphs have updated too. Everything is updated in seconds, right? So think about all that time you spent putting these together, where you just have one click and boom, it's refreshed. So you do the same thing in Word as well. It's a really cool functionality. Again, time is money here, and we want to make sure that your process is as automated as it can be, and Adaptive is definitely a solution that's been tried and true, especially in the healthcare industry, and gives you more reliable and accurate data within your planning and within your reporting process altogether. So if you're interested in learning more, there's plenty other features and use cases. Would love to talk more about how and give you a little more flavor of how this could work for your organization. So just let us know after the meeting, and we would love that. But I think we have one more polling question here before we wrap up.
Yep, awesome. That was great. So here we go. Whoops. All right. Are you considering changing your FP&A system in the future? Yes, within the next 6 months, within the next year. You're happy with your current situation or not sure? Couple more seconds. All right. Awesome. Some people are happy and some people are looking for a switch. We're happy to help. Oh, sorry, I didn't share that. There we go. All right. Awesome. Well, I think that wraps up our presentation. Really appreciate everyone joining us today. Ron, Gabe, great information. Here's an email if you guys want to connect with us. We're happy to assist further.
Hey, Tracy, I know we got a couple
Yeah,
minutes left. Can I just add a
sure.
comment?
Of course.
So we've shared with you the information, and my hope is that you've learned why it's important to be able to do this. Have an automated system. Think about how long it takes your personnel to accumulate all that data to put it in an Excel format versus having it automated, updated. The ease that Gabe showed in terms of updating reports, et cetera, is a way that people can spend more time focused on patient care than the minutia of what you would have on an automated system. It's incredibly important. The other thing I would just throw out to you, and I appreciate all the different people that are joining. Some of you are from big organizations, some of you are for smaller organizations. If you think about the M&A world and you think, our only solution is we have to sell, we can't be whatever, they're going to ask for information that may take you an incredible amount of time to put together versus having something like this that gives you that information at your fingertips to be able to, again, the focus of this is not only informed decisions, but it's how long does it take you to get those informed decisions and personnel that could be transitioned to do something else of greater value. So
Awesome.
that's my closing thought.
Thanks for your closing. Yeah, I was just going to say thanks for the closing thought. All right, everyone, enjoy your day. Thanks for joining. Take care.
Thanks, everyone.
Thanks.